Do you ever feel like you just don't have the time to sit down and read the news every morning? Sometimes things get so hectic you can't even scroll through your feeds while you're trying to get ready. A new podcast from Boise State Public Radio has you covered. I'm George Prentice, and I want to invite you to check out The Connector every weekday morning. You can get up to speed on all of the Idaho news you need to start your day without ever interrupting your morning routine. All you have to do is hit play. That's The Connector from Boise State Public Radio. Find it wherever you get your podcasts.
From the studios of Boise State Public Radio News, I'm Samantha Wright, filling in for Jim Gaudette. This is Idaho Matters. Since before the Idaho legislature came to town in January, supporters of Medicaid expansion have been worried that some lawmakers want to put guardrails on the health insurance program that voters approved back in 2018. A bill that would make 11 changes to the program, including a lifetime cap on benefits and work requirements, made it through the House but is stalled on the Senate side. But two more bills are floating around the State House, which lawmakers say would reform the program and save taxpayers money. Randy Johnson, the Government Relations Director for the American Cancer Society Cancer Action Network, and Hillary Hagan, Senior Policy Associate for Idaho Supports Medicaid, were here in January to tell us about the first bill, and they're back to tell us what's been going on since. Hi, and welcome back to the show.
Hi, Samantha.
Well,
Appreciate you having us on again, Samantha.
no problem. Okay, help me out here. I think we've got three separate bills, very similar in some respects. They would all affect Medicaid expansion in some way. We've got House Bill 138, 328, and 345. I don't want to get too caught up in what's in which bill. We'll get into that a little bit. I need what's left of my brain for the rest of today. But let's go back to the original bill, House Bill 138. There's a lot in this bill. A couple of the main points are a 3-year lifetime cap, work requirements, and limiting enrollment in Medicaid expansion to about 50,000 people. Now, it is stalled, I will admit that, but I want to break down a couple of the points just to show what lawmakers are thinking about. What kind of work requirements do lawmakers want, and why do you think those might not be the best idea?
So it's a really good place to start, Samantha. And I'll just go ahead and jump in, if that's okay, Randy, to kind of talk a little bit about that. So currently right now, House Bill 138 has 11 conditions that is requiring the state to add to the Medicaid expansion program. And if they fail to do so, the end result is repealing Medicaid expansion. And to get into some of those more finer details about the bill, yes, there's a lifetime limit, an enrollment cap, as well as the work requirement. And when the work requirement is really what a lot of lawmakers are very interested in pursuing for the Medicaid expansion population. And the problem with the proposed work requirement is that it's really more of a work reporting requirement because of the amount of paperwork they're requiring individuals to submit over and over again on a regular basis, on a monthly basis, in order to continue receiving Medicaid under the Medicaid expansion program. And we've seen this played out in other states where many people lost coverage, even if they met the requirements or an exemption, because of the red tape that this type of policy creates.
So let's break that down into two parts. One, I think you're talking about death by 1,000 cuts. You're talking about so much red tape that eventually you would fill out something wrong and get kicked off or something would happen. And then the other one is the idea that a lot of the people on Medicaid expansion already work. And I know that the both of you have talked about this before, but you have pointed out that a lot of the folks are employed who are getting Medicaid expansion coverage.
Yes. So to qualify for Medicaid expansion, you have some sort of household income. You are a lot of people who are on Medicaid expansion are currently working. They're working multiple jobs, multiple part-time jobs. They're in jobs that don't provide health insurance, and they're low wage types of jobs. And so to require that people go through these extra hoops to continue proving that they're having a very specific kind of work or making sure they're going to school or volunteering or meeting any level of exemption really truly just adds so many layers of bureaucracy and red tape that makes it hard for people to navigate and doesn't get to the point that, yes, many on Medicaid expansion are actually working.
Let's look at the lifetime cap on benefits. What is this? How would this work?
So the lifetime cap essentially means that if you are covered under Medicaid expansion, you cannot be on it for more than 3 years in your lifetime. So let's say you're on it for a year in your 20s, you fall in hard times in your 30s, you're on it for a year, then maybe in your 40s, something else happens and you need to fall back on it again for another year. If you get to your 50s and something happens, you no longer are able to access Medicaid expansion.
Randy, I want you to jump in. You, at the Cancer Network, obviously talk to a lot of people, deal with a lot of people who are going through cancer treatment. What would happen if, someone is going through cancer treatment and maybe they're getting close to that 3-year cap? They could, in theory, get kicked off of coverage, even though they still need treatment.
Of course, Samantha, it's a devastating for cancer patients, and cancer touches everyone's lives, and as most people know, it's not just you get diagnosed and a day later you're feeling better. It can take years and sometimes it's a lifetime of battling cancer, and so to put a limit on folks is a devastating for cancer patients who are already handling the worst news that they've heard. You have cancer, and now they have to decide how long can they be on it? Are they working enough? Do they have a doctor's note? They're trying to figure out what kind of medication, what kind of quality of life, what does this mean for their family? And I think Hillary hit this, and I think all these bills that we're going to talk about today, it's a systematic effort to remove people off of a Medicaid expansion and really disregard the will of the people. And for us, I mean, that's really that's what way I see it comes down to is, if you have work requirements, if they can't repeal it outright, what provisions can they put on to systematically start reducing the number of people? And it's devastating for people who are doing the right thing, for Idahoans who have a good work ethic, Idahoans who voted that we want to take care of our neighbors, and all these requirements that they're putting on now just flies in the face of what voters wanted and have continued to say that they want.
Okay, so House Bill 138, it got held in the Senate Health and Welfare Committee by Chairwoman Julie Van Orden, and it probably won't go any further. It might, but it might not. But there are 2 other bills that have popped up, and I understand there's been some activity on one of those this morning. Hillary, what's been going on?
Yeah, so House Bill 138 has yet to have a hearing in the Senate. It technically still could. However, the bill that had a hearing this morning is what lawmakers are considering to be the compromise bill to 138, and it is expected that this one will get more traction in the legislature than 138. However, they are still holding on to the Medicaid expansion repeal bill until they see what happens with this bill from this morning, which is House Bill 345. And this bill is very different than 138. It doesn't have as many conditions as the previous bill, and it really tackles the whole Medicaid program. And the provisions in this new bill are moving all of Medicaid to a comprehensive managed care program. It also adds cost sharing to Medicaid expansion populations. It changes the way the department renews eligibility, requires more frequent eligibility checks. It also changes the way paperwork is processed, and it adds on this really restrictive work requirement for the Medicaid program. or Medicaid expansion program. And it did pass out of committee despite several hours of opposition to the bill. And it passed on a party line vote out of House Health and Welfare Committee this morning.
What was some of the public testimony like?
A big concern about the work requirements is that we're just creating a bureaucratic system of red tape that we're asking people to jump through, even though data shows that the majority of them already are working. There is a significant concern that we're going to see massive coverage losses in Medicaid expansion if this becomes implemented in the state of Idaho. Many of the provisions have played out in Arkansas, and we saw devastating effects there. And so a lot of the testimony was really focused on this just adds hoops for people to jump through, and the result is kicking people off of Medicaid.
Can we talk a little bit about the federal match rate? I know one of the bills would allow health and welfare to cut benefits or lower how much doctors get paid if the federal match rate drops, which is not out of the realm of possibility. What is the match rate, and how would that affect folks on Medicaid expansion?
Yeah, so right now the feds pay 90% of the cost of Medicaid expansion, and the state covers 10%. It would take an act of Congress to change the match rate. This new bill, House Bill 345, gives power to the Director of Health and Welfare to, if that match rate drops, he has the authority to go in and make cuts to help offset any increases the state would be on the hook for. The concern that some of us have is that the language is not really prescriptive to, is this just for expansion? Because how it's read right now, it appears as though they would have the authority to cut optional services like home and community-based services and other services that impact other Medicaid programs.
We're speaking with Randy Johnson, Government Relations Director for the American Cancer Society Cancer Action Network, and Hillary Hagan, Senior Policy Associate for Idaho Supports Medicaid, about Medicaid expansion in the Gem State and in the Idaho legislature. Let's talk about waivers, too, because this has also come about. A lot of these provisions that lawmakers are talking about, it would have to get federal approval before Idaho could start doing these things. So even if some of the requirements become law, they can't just start right away. Why do they need a waiver? Why would it take a while? Tell me about waivers.
So the thing about waivers is really it's an application to the feds where the state says we want to deviate from current Medicaid rules. And the provisions they are attempting in these pieces of legislation do require the federal government to approve them because they're not a part of current Medicaid law. And that process is very arduous. It is time consuming. There are actuarial analysis that have to be done. There are applications to fill out, public comments that have to be acquired. And then you have to go through the federal approval process. It can take anywhere from a year plus to go through just the federal approval process. And so it's going to take some time to develop these. It takes time to go through all of the public comment periods, and there's a lot of questions and concerns about what might actually happen on some of these waivers.
Randy, we've heard some lawmakers say that we have to do something to rein in Medicaid expansion because it's taxpayer money and the costs keep going up. But as someone, again, who works with cancer patients every day, what kind of an effect would that have if we lost Medicaid expansion, or if it was a lot harder to get?
It's difficult for families to navigate cancer or any other disease. And, we have an estimate about 15% of working age Americans have a history of cancer, have relied on a Medicaid and Medicaid expansion for their health care. And by removing that away from folks, again, it's one of the most devastating news you can hear. And to just remove people from their health coverage, it doesn't mean they're not going to be sick. It doesn't mean that their cancer goes away. It means they're going to go into medical debt. It means they have to spend time in the ER at great expense to themselves and to the hospital systems and to counties. You know, just by removing people doesn't make it less expensive for the state. It just shifts it off of their line items and forces it on to other items. You know, we have seen mental health rates go down under a Medicaid expansion. We could see, it's helped our prison budgets. It's helped our hospitals. It helped people, again, not go into medical debt. There's so many different ways in which it would be just devastating for people who, again, are doing the right thing. People on Medicaid expansion are doing the right thing. And for us just to say, sorry, you're not doing enough or you don't deserve to have health care because you're sick and you're not working hard enough, that's not the Idaho way that I grew up in. And so to me, and cancer patients in Idaho are feeling the same way.
Hillary, we've got about a minute left. So which bill should we be watching right now? And what can folks do if they want to talk to lawmakers about any of these bills or any of these ideas?
Yeah, so right now, House Bill 345 looks like it will be the one moving forward. However, it's getting towards the end of session. Tensions are high, and I would not keep our eye off of 138. It's very likely it could potentially poke its head up in the Senate, especially if something happens where House Bill 345 that moved this morning doesn't make it over to the Senate. And so I think we just have to keep an eye on both and talking to our lawmakers about the value of Medicaid and how important access to healthcare is really important. And it's pretty easy to find access to your legislator. Just go to legislature.idaho.gov and type in your address and who's my legislator and see who your local official is. And you can pretty easily reach out, phone call, email, and tell them how important this issue is to you.
I want to thank you both for coming back on today, and I have a feeling we're going to have you back on before the next month or so is out. Really appreciate it.
Sounds good. Thanks for having us.
Thank you so much, Samantha. And I just want to say real quick, if anybody's listening, if them or their family is handling cancer and want to have resources, I encourage everyone to visit cancer.org to get more information as well. But thank you for having us on.
You're welcome. We've been speaking with Randy Johnson, Government Relations Director for the American Cancer Society Cancer Action Network, and Hillary Hagan, Senior Policy Associate for Idaho Supports Medicaid, about bills to make changes to Medicaid expansion in the Gem State.
I'm Gemma Gaudette, and this is Idaho Matters.